Hey guys, welcome to the Fieldcraft Sorrel podcast. I am your frigidly cold host, Kevin Estela. I was just out scouting a property in 35 to 45 degree weather for the past hour and a half, and I am freaking cold. Guys, with me today is a good buddy of mine, someone who you've probably seen on the podcast with Kevin Owens, and probably another podcast, because this is the second one for you today, right?
Yeah, I think so, yeah.
So, and I'm going to screw up the pronunciation. I'm going to do my best to give this Irish name the best pronunciation. But Dr McElvaney.
Very, very good.
Oisin McElvaney?
Yeah, Oisin McElvaney. Yeah,
Oisin
good.
McElvaney.
Yeah, very good.
McElvaney.
Yeah.
All right.
Yeah.
Well, guys, today's going to be a good one. And actually, the current state that I'm in, really frozen, or working on getting frozen, is the topic of discussion. We're going to be talking about cold-related injuries, what happens to the body, heat loss mechanisms and whatnot. And, you know, at the current time that we're recording this, it is the holiday season. So I actually brought in something special. I'm not sure when this is going to be broadcast, but, you know, they say fruitcake lasts forever. So at some point today, I might have to break into that as you're talking. I might have some. You know, it's the finest fruitcake you can get. And I know this is probably going to come out after the holidays, but I guarantee, I mean, this is good till almost June. So by the time you guys are watching this, I probably will have consumed about half of it, but that will still be okay. So, second podcast. Here we go. So let's kind of give everyone a bit of a background on you, why we're bringing you in as our medical expert. I mean, you are one of our resident jokers here. You have some of the best storytelling ability I know of. But what is your medical background, Doc?
Yeah, so I mean, like, I specialize in respiratory and ICU techniques. MD, PhD from Ireland, come over here. Been working for Fieldcraft for a while now. I've done other things overseas, as you know, and I'm not going to talk about it on the podcast.
Yeah.
But so I have a little bit of knowledge and, you know, a bit of experience in what we're going to talk about today.
Mm-hmm. Yeah, MD, PhD. So the MD, obviously, for those of you that might not know, medical doctor. And the PhD, what was the doctorate in?
It was actually in COVID-19 and alpha-1 antitrypsin. You don't have to worry about it, man. You know, it's just boring stuff.
Okay, understood. So, guys, we're going to be talking about cold-related injuries. And listen, I think every one of us has been cold at some point. And from the survival instructor perspective, when I teach cold and how to mitigate the cold, we teach about the different ways that your body loses heat. So some of the big ones, respiration, right? When you walk outside and you breathe in cold air, that cold air is going into your body and cooling you from the inside out. Then there's conduction. Like if this table were cold and if I were to put my hand on the table, I can instantly feel the cold from the table. And then you have perspiration. I think we've all sweat at one point. We stopped moving and it got really cold because we have water and moisture on our body. Then you have convection cooling, where the wind blows and it's like, whoa, that wind, that's why I'm freaking cold right now. When the wind blows, that can also help you lose cold. And then you guys probably also know that like some people are just radiate heat. Well, when you're radiating heat, it means that you're losing heat. It's kind of like when a dog sleeps next to you in your bed, dog is super warm. Well, you can lose body heat that way. And then probably the scariest one is immersion, right? Falling in the water. So that's my perspective when I teach, but something that's often overlooked is what exactly is happening to the body when these different things are happening to you. Like, have you ever wondered why you shiver, or have you ever wondered why, you know, fingertips and toes get really cold? We're going to do a deep dive into those. So what do you think the most common misconception is about cold-related injuries, Doc?
Well, that's a good question. I don't know what people's, to be honest with you, on a one-to-one basis, I don't know what people's knowledge level is on this.
Let's pretend like they're a middle school kid, right? They're learning about it for the first time. They never listen to their parent about, hey, put on a jacket when you go outside. Yeah.
Well, look, I mean, like, all I can do is say what I think is common sense. And,
okay.
You know, common sense isn't that common, but, you know, like, the biggest risk to a lot of people, particularly when it's not that cold in North Carolina, but if you're in a place like Utah, for example, Montana, in Ireland, you know, where it's nice and cold most of the year, Really, you have to look out for signs of hypothermia. Now, with regards to hypothermia, there's certain basic things. Get yourself out of the cold. If it's freezing cold, go somewhere warm. Create an external source of heat. How you dress is important. Multiple loose layers, really important. Basically, you don't want to have a situation where you're perspiring a lot, getting that cold, damp, moist kind of scenario, which is going to freeze. And also just recognizing the signs of hypothermia as they develop. Like you're talking about shivering there. Like shivering is like the first stage of hypothermia. You're shivering, you have a bit of mental confusion, but you're more worried when that person stops shivering, because shivering is like a thermoregulation. It's basically your body trying to generate heat. And hypothermia, by definition, is when, put it in basic terms, it's when your body is losing more heat than producing it. You're going to lose more heat through skin than anything else. So when someone stops shaking, that means thermoregulation is gone. From there, it only gets worse. From there, you get increased confusion, and you get things, if people are really cold, they get paradoxical undressing. So they'll get very confused, they'll feel very warm, they'll feel very hot, and they'll start tearing off layers, even though that's contrary to the scenario they're in. And of course, if it's profound, they're going to start having a very weak pulse, very low respiration rate, and eventually no respiration rate, and go to cardiac and circulatory collapse. So these are the sort of from mild, the shivering, all the way to profound.
You called it paradoxical undressing.
Yes.
My late mentor used to do search and rescue up in New York, and they were going after a guy, and they said, hey, this guy has bright red hair. And I remember that detail of the story, bright red hair, and he's wearing this, and he's about this tall. And they ran down the bio of what this guy's going to look like. So they were up on this one mountain, and they're in the middle of the night, they see this naked red-haired guy, and my late mentor used to say that they knew he was red-haired because some guys were looking at his head, some guys were working the flashlight up, and they saw red other places. But they saw this naked man running down the trail in the middle of winter in the dark, and they're like, how many naked red-haired guys could be missing right now?
Yeah, I mean, you
right?
got to be really careful with frostbite. A ginger snap in the real literal term,
Oh, jeez.
Yeah.
So they ended up tackling the guy, and when they eventually asked him, he's like, I felt warm.
Yeah.
So I guess that's that paradoxical undressing.
Yeah.
What about this idea? Like, have you ever heard someone say, like, oh, I don't need to put a hat on my head? And there are some people that say, your body loses the majority of heat through its head. And I'm thinking, like, yes, I have a big head. You said you're a sniper's dream.
Yeah.
But I also know that I have a lot more surface area elsewhere. And I think some studies have proven that.
Yeah, that's kind of a wives' tale. Look, there's certain aspects, there's certain kernels of truth. I mean, like, as I said, through skin, you lose most of, you also lose it through respiration as well. But through skin is the most common way to lose heat. Obviously, covering more surface area is better than not covering more surface area. But like, you're just as likely to lose it through having an exposed torso and if the ginger guy had a hat on but nothing else on, he'd still be hypothermic, Right.
Yeah. And the whole shivering idea, the jackhammering, Jerry calls it jackhammering. He's like, oh, we're doing that. How long can a person jackhammer before they go into that stage? Like, is it person by person?
It's person by person. It's also temperature as well. I mean, like, America can be very, very inhospitable in certain places. Like, you'd wonder why people live out in a place like Alaska during the winter. It's not really meant for to be inhabited in some places. But like, if you're getting below, even if you're getting below 31 degrees Fahrenheit, you run the risk of things like frostbite. So I mean, like, as you said yourself, it's person by person. It's also location and the overall temperature.
We talk about like the most dangerous weather.
Yeah.
Jerry mentioned it today. Brian Edwards mentioned it today. We're like 35 to 45 degrees, not quite frozen, and a slight drizzle and a little bit of wind.
Yeah.
That to me is a nightmare.
Oh, 100%. That's Ireland, actually, by the way.
I kind of was trying to like walk into that one.
Yeah.
So what did you experience when you were in Ireland, like going through medical school and your own personal experience? I know you're big into the outdoors. Like, talking about that, how do you combat that? How do you bring someone back from that? I mean, you mentioned take them out of the environment, give them something warm.
I mean, like, It's funny, like we actually did a bit of camping there recently, and everyone's like, it was freezing last night. I was like, it was toasty. It's fine, you know. No, in all seriousness though, I mean, common sense things, you know. I mean, like, again, as I said, take them out of the cold environment if you can. Slowly warm them up. Don't try and just shock them with heat, especially if there's aspects of frostbite. I'll talk about it later on. But I mean, basic things. Have a thermal blanket or emergency blanket ready. Use your own body heat to warm the person up. If you don't have that, like we're in North Carolina at the moment, you have tons of pine straw. Get some pine straw, get it in a refuse bag, use that as insulation. There are things that you can do to regulate heat that are a bit more advanced. Like, quite frankly, if your core temperature is really, really low, that's what we have to be more concerned about. You know those hand warmers you can get?
Yes.
Yeah, don't put them on the extremities, because you're just going to cause all that coolness to go into the core and cause a massive drop in core temperature. You want to put it, if someone is hypothermic, you want to put it in their neck, chest and groin to maintain the heat there. You know, the extremities are obviously very painful if you have freezing cold extremities and they're not being properly perfused. But ultimately, what's going to kill someone is if they don't have a properly supported core temperature. You know,
Kevin was talking about that actually before we jumped on this podcast, about going through selection, seeing guys get super, super cold, and then they were told, well, do jumping jacks, flutter kicks, and whatnot. So can you explain what happens to the body, like maybe a little bit more detail, if someone is really cold and they're told, just run in place, do push-ups, do burpees, like what happens?
Well, see, I mean, like, it really depends. I mean, obviously, I'm not going to pick faults with the Q course or the instructors there. But if someone is profoundly hypothermic, probably not a good idea. You want to give as many supportive measures as you possibly can, which basically means you don't want to be overexerting a person. Also, you don't want them sweating as well, which is another thing, really. Sweat and cold weather is just a horrible mix. That can lead to that'll obviously lead to a lot more cooling than we want. But as I said earlier on, the main thing we want to do is keep them warm, give them your body heat, put them in an emergency blanket, create an external heat source. If they're profoundly hypothermic, their core temperature is really, really low, you can do things like rectal rehydration, where you actually warm the water. It's not a fun thing. People talk about austere med like they want to do it, and then they realize what it actually entails. You don't do that unless you're totally Bear Grylls-esque screwed, you know, with regards hypothermia. But
rectal rehydration.
Rectal rehydration works. I mean, like, you'd increase. It's actually, funny enough, known as a Murphy's drip, Irish American invention. Like Murphy's Law, it can go horribly wrong. No, if you're going to do it, let them know you're going to do it beforehand. What you want to do is you want to get the water itself a few degrees higher than. You want to get it warm. You don't want to get it boiling hot for obvious reasons, but you want to get it. I'm trying to get Fahrenheit right here. About 105 to 110 degrees Fahrenheit. And you can basically check by putting your elbow into the water. And if it's warm but not scalded, you know it's the right temperature. You can use a Camelback after you've boiled that water. It can be any water. It can be from the stream. It can be from anywhere. I'm boiling it for the heat. It doesn't necessarily have to be totally pure, clean water. Put it into your Camelback. Obviously, you're going to insert it into the patient. You're going to insert about 10 centimeters, pushing the patient onto the left, so you go into the sigmoid colon. That's really, really, it's very vascular, and it's great absorption in that area. And then you're just going to lay the fluid on the side of the patient. You're going to insulate that with a couple of jumpers or whatever around the Camelback, so it doesn't lose heat. And you're just going to allow gravity to do its work. You're not going to push that bag, because that's a form of torture they did in Abu Ghraib, and it's going to ruin your shoes. But I mean, like, you know, you're just going to let that water flow, and that'll actually bring up their core temperature significantly in an austere situation.
Because you don't want to just give them
cold water.
Cold water, right? No, that's going to cool it off.
Funny enough, with hyperthermia, you do the opposite. You get cold water and do it that way with a ton of isoelectric additives into it. You can. Hyperthermia and hypothermia are two sides of the same coin. It's just a mismanagement of your thermal regulation.
You know, it's funny you say that they're two sides of the same coin, because my late mentor used to say, the treatment is exactly the same.
It is.
But he would break it down by saying remove from the environment, gently rewarm or cool,
Yeah.
but it was never exaggerated. And it was introduced water, and it was either warm or cool, but it was never the extremes.
Yeah.
Yeah,
exactly. And I mean, like, again, you mentioned it really well there as well. Like, when you're removing from the environment, it's not just that they're getting warmer, it's they're drier as well. You really need to take off, like, socks are a big one, like wet socks from marching all the time. Take those off, dry off the feet, make sure they're warm. That's why the loose layer of clothes are better than something that's a bit tighter, because you're not going to have a thin film of fluid on your body.
Yeah. The military uses the acronym COLD, right? So keep your clothes clean. That's the C. Avoid overheating. That's the O. The L is dress in layers, and then the D is dry.
Yeah.
So if you just remember those 4 things, I mean, stay clean, don't be pigpen, right? Don't overheat, meaning don't, like, if I were starting the day, I wouldn't wear this with a heavy backpack and go. I'd actually go cold. I'd be bold cold, right,
Yeah.
early on.
Oh, yeah, and you'll warm up yourself. I mean, like, I'd wear something light like this, and then I'd go off marching, and I'd be relatively warm within 20 minutes. I mean, the other side of it as well is, like, maybe it's an Irish thing, but with camping, everything went into a garbage bag. Socks, jocks, everything else, because inevitably you get soaked.
Right.
I mean, I'm sure it's the same here.
Yeah, and I mean, John, who works with us here, was talking about how, in America, we tend to like putting everything in stuff sacks. Like, oh, I want to put this in a stuff sack. Yeah. But if you look at some of the old ways that, like, canvas backpacks were carried, before the days of, like, sil nylon and all this crazy stuff, they were using, like, not polyethylene, or maybe it is polyethylene, like plastic bag liners. Everything got stuffed in there. And it was easier to put a sleeping bag into the bottom of your pack, because traditional stuff sacks would make it like a basketball.
Yeah.
But if you kept it loose, you could push it down and then put stuff on top. But again, that was a different way of doing things. Yeah. We talked about the core. Let's talk about these
extremities. Yeah.
Yes.
Yeah. I mean, so.
Like, and while you do that, I'm gonna have some pound cake or a fruit cake, because that rectal rehydration. Oh man, that just, like,
you just want to, like,
like
anytime anything slightly revolving around rectal, you just want to
rectum damn near killed them,
yeah.
So I gotta try this.
Yeah.
So sure. All right, so let's talk about extremities.
So like, for example, I mean, like, most people have this experience. They're they're cold, their fingers are blue, or they're numb, and that's basically your if you did a capillary refill, which is just pressing down the top of your finger and releasing. Hyperperfusion, or basically not enough blood getting to your extremities, is if it doesn't return to its normal color within under 2 seconds. That's hyperperfusion. And that can happen for a number of reasons. Like, for example, we talk about hypothermia in the setting of the cold, but if you've lost a lot of blood, or if you've had circulatory collapse, like a heart attack, you're going to be profoundly hypothermic, because your blood is what's heating you. It's traveling to every part of your body and it's heating you. Now, what happens is, obviously, if you don't get enough blood supply to your digits, well, tissue begins to die, and we see that quite frequently with a frostbite. I've seen that personally overseas, where I was, and I mean, like particularly when you're in really cold, freezing, frigid environments, some people don't even notice it's happening, particularly if they have other things preoccupying themselves. Now, essentially, I'm not going to go into the exact pathophysiology because it's a bit complex with regards to frostbite, but any temperature under around 31 degrees Fahrenheit, you run the risk of frostbite if your digits are exposed. And unfortunately, you start to know tingling, pain, then obviously a loss sensation, and when your fingers turn black, I mean, at that point, a lot of the tissue's dead. Now, if you start to notice it at the early stages, there are things you can do. You basically slowly immersing it into warm water is the best thing you can do for frostbite. Likewise, using the elbow method to determine if it's between around 105 and 110 degrees Fahrenheit. That's a perfect kind of temperature. Slow immersion into warm water. You run the risk of reperfusion injuries if you just reheat it suddenly, and you just want a nice warm bath, basically, for your digits or your toes. you have to be very, very careful when you're dealing with them as well, because, you know, if it's very far gone, most of your digits will auto amputate. You don't have to cut them off; they just come off. So I remember taking off a sock for one young lad, and I was like, "Oh, he only has 3 toes," and shake out the sock, and then there's
auto amputate. I've never heard of that expression.
Yeah.
I mean, I know crabs will do that. Like when they're about to die, they start popping legs. But I didn't know humans could do that.
Yeah, they shouldn't. But I mean, like, you know, it's not something that's ideal here. You know, I mean, like you see it with diabetics and people with peripheral vascular disease, and it's the same idea. Like basically, blood is not getting perfused to those digits. It'll turn black, very much like this microphone or a bruised banana is what I usually look at. If you flick it hard enough, it's going to come off, and it's unfortunate. It's incredibly painful to a certain point, and then when you can't feel any sensation at all, well, I mean, you have absolutely no no hope of recovering that. I mean, the things that you can do early on are very, very useful, and it prevents it becoming a serious problem. Like if you start noticing the telltale signs of frostbite early on, as I said, slow immersion into warm water is the way to go.
Mm-hmm.
Warming your hands, putting them under your armpits, groin area, keeps them warm if you don't have access to water. But if it's gotten to a point where there's actual tissue damage, that's kind of where you're in the realm of either I'm going to have to amputate it for you, or it's going to do it itself.
And you're amputating above the black, right?
Yes.
Where there's still sensation.
Yeah, I mean,
not pleasant.
No, I mean, like, and it's obviously like the particular young fella that I was looking after. He was a very young guy. It's pretty disconcerting when you lose 3 toes and you're only 22. You know.
Damn.
Yeah.
Now, there's obviously warning signs before auto amputation.
Yeah.
You mentioned, the capillary refill. Yeah. I know that some of the old survival schools used to say, like, can you touch your individual fingers to your thumb?
Yeah.
That was a big one. We were just talking today on the hike about taking off the sternum strap on a backpack and how when your hands are so damn cold,
painful.
Even getting the muscular strength to pinch that buckle that normally you could pop easily.
Yeah.
Like you're there now with like trying to push bone on bone.
Yeah.
And it's almost impossible.
Dexterity goes really quickly as well when you're cold. I mean, but like you kind of go into a phase called frost nip before you get frostbite. Frost nip is where you have the same kind of symptoms but no real physical tissue damage. And like, it's that tingling, painful sensation. A lot of people have experienced this before, but if you're having that sensation, it's prolonged. Like everyone's had that scenario, they just put their hands in their pockets or warm them up or go inside. But if it's really prolonged and you have absolutely no way to battle the elements, it could potentially lead to frostbite.
Back in the day, I used to hear people say, "Swing your arms," right? Force the blood back into your fingertips. And then I know, obviously, before we lose dexterity, my hands get chapped in the wintertime.
Chilblains. Yeah.
What is it called?
Chilblains. Yeah.
What causes that? Because like I'll notice, like I'll go in and I don't
get like puckering of the skin and redness.
They crack and sometimes like they'll actually open up and
like you base again, like everything is supplied by your blood vessels. You're not getting adequate blood supply. Your skin's going to suffer as a result of it. I mean, like everything, really, the most of your heat generated, most of the heat generated in your body is by your heart just pumping.
Mm-hmm.
I mean, like and that's pumping that warm, hot blood all throughout your body. When that stops happening, like when you're actually developing frostbite, you're developing little ice crystals in there that are basically causing massive tissue damage. Then eventually you get capillary leakage. You get a lot of other things I'm not going to go into here. But basically, I mean, once you are not able to properly thermoregulate your body, you're in serious trouble. And you could see why a lot of people die in training exercise, particularly like not so much in the American special operations community, but you see it with the British. With the SES have a drill out in the Welsh mountainside, where a lot of people are exposed to the elements. Quite a number of people die of hypothermia. I mean, there's a certain point where you're like, we want to push people, but that's stupid. I mean, you should have common sense to recognize that you're pushing someone far too far and expose them to the elements, which is not a smart idea.
Now, okay, so you just said that the body is producing all the heat, but that your body is able to produce that because of nutrition.
Yeah.
Right? So now calorie if I remember correctly from my science days, it's the amount of heat that's required to raise 1 gram of water 1 degree.
Yeah.
Am I correct on
That's
that?
right. Yeah.
You know, not bad for an Asian that is a history English guy, not a math science guy.
My God.
So I know, right? Also a better driver than most Asians.
Hey, look, better driver than some Irish people. You've seen me. You've seen me go. With my Lincoln.
Oh, that is. Yeah.
Yeah.
So now, food. Let's talk about food and drink. What you should consume if you want to, what would be the best nutrition in your mind? Would it be a lot of carbohydrates, a lot of protein, a lot of fat? Like if you could choose a diet for someone going into the cold, what would you say is like, hey, watch out for this or have more of that? Like
to be honest, I mean, you need a bit of a mix of all of them, really.
Yeah.
I mean, carbs are great though, because you want to load on as many carbs as you can. You're going to burn through that pretty quickly. You know, I hate to say it, but a hot meal, not only does it help with regards to thermoregulation, but it's also the fact that it improves morale massively. Eating a cold MRE is miserable. It's miserable. I've done it. It's miserable.
Yeah.
It's not a nice meal to begin with, you know.
You don't want to bite into that cold ham steak.
Oh no! What was it? It's a Mexican dish they have in it. It's like cheese and all cheese bean burrito or something like that. It's not good when it's hot. Never mind when it's cold. But ultimately, you want to get as many carbs in there as possible. Basically, you're going to burn through all that. You're going to use it as energy, but you need a good mix.
Is there a risk of having too much salt in the winter?
I don't really think that. Well, to be honest, I'm sure there probably is. There's probably some scientific studies on this, but ultimately, in the acute scenario where you're just freezing, like if I saw something with a high sodium content, I wouldn't care. I'd have eaten it. I mean, I wouldn't be too concerned about that, really. I wouldn't be massively concerned about salt or sugar intake rather than just trying to get those carbs into me.
Yeah, just calories. Just get them in.
Yeah.
Now, what about beverages? Caffeine.
Yeah, that's a really good point. So, I mean, you want a warm beverage. One thing there's a lot of people who'd be saying, you want a warm beverage, right? Sip a warm beverage. Lots of sugar. Caffeine isn't the worst thing in the world. The one thing that is really bad is alcohol. People have this misconception that alcohol warms you up and actually causes vasodilation, which isn't particularly helpful in some scenarios. It's just it just doesn't help. I mean, I would avoid alcohol if I could. Vasodilation happens when your blood vessels get closer to the surface of your skin and you lose more heat that way. It's basically when you're really, really hot, you can see, when you're sweating, you see veins popping out of someone's hands. When you're really cold, you can't see the veins. Vasoconstriction is just a way of your body trying to regulate its heat. Alcohol is kind of counteracting that to a certain degree.
And it's also a depressant, right?
And it makes you bleed more.
So now in the middle of winter when there's no sunlight, you're not getting vitamin D, you're also getting colder and you're feeling miserable. And like you said, you're going to bleed a lot. Yeah.
It's funny that we really shouldn't be that popular in Ireland, but it is. It's dark, it's cold. You bleed more with it, and yeah.
What about tobacco and marijuana? Because those two are used frequently by outdoorsmen, hunters, fishermen. Hopefully not when they're surrounded by guns, using weed, but... Yeah,
I mean, look, if you talk to any soldier, I mean, tobacco is a great way to... It basically suppresses appetite. It doesn't really... It suppresses appetite, it helps with anxiety. Ultimately, though, it doesn't have any real positive properties. But, if it takes your mind off something, it takes your mind off something, I guess. Weed, I mean, it's been legalized in a lot of the states here in the United States. I'll be very honest, I mean, you see a lot of people talk about the advocacy of medical marijuana. I honestly wouldn't be that supportive of it because of the things that it may be linked to. I mean, for example, there's quite a lot of... I can talk about cold weather, right? But what I can say is that it is certainly linked as a cause of effect with mental health issues such as schizophrenia, and that's more causes rather than being just linked to it. So I would be cautious about promoting that in any way, shape, or form. it's kind of funny. It's become a very popular drug now in the United States. It's always been a popular drug in the United States, but it's become more respectable, I suppose. But it is kind of funny. It's like the ads you see for it now are the exact same as the cigarette ads you saw back in the 1920s with the doctor saying 1 in 10 doctors recommend Camels.
Mm-hmm.
And, I'd be very, very cautious about it. There are some studies showing it increased the risk of stroke, and there's also other studies that there's a lot of studies showing about the risk with mental health. So I kind of steer clear from that.
Yeah, the ads in the 50s for Coca-Cola were some of my favorite, where you got this picture of like the Gerber baby, like picture of health, and the kid's smiling, like healthy, good old baby. And right next to it says Coca-Cola will help develop your child's personality. They'll have friends. It's like, if a kid doesn't drink Coca-Cola, he's going to be a weirdo. Probably someone that's going to probably comment on this video, or whatever.
But, look, I mean, like I'm sure I'm going to get a lot of hate because of what I'm saying with regard to
embrace
cannabis.
It keeps you warm, right? That was the line from Red Dawn, right? All that hate's going to burn you up inside, boy. It keeps me warm, right? As he's like carving the notch into the stock.
I mean, look, I'll say this, and like Kevin Owens says this as well. Kevin says the difference. Kevin Owens is a true expert. He's like a real expert with regards long distance shooting and sniping and all the rest. And he's like, I'm not an expert. It's just based on my experience and my opinion. Of course, that's also based on like I don't know how many years in special operations. But look, my opinion on this is based of my professional opinion and the years I put into it and the amount of doing my PhD in medical science as well, looking at tons and tons of medical literature. So I mean, like, it's my opinion based on my experiences. That might not mean much, but it's what I have to give.
You mentioned respiration, and is there a way that you recommend for people to combat breathing in cold air? As a kid, I remember going out playing in the snow, and my mom would put a scarf over my face. And I mean, I was breathing through this scarf, and after a while, the moisture in my breath would freeze on the outside. And I'm like, this sucks. And I'd pull it down, and then my whole face would get cold. Is there a way that you'd recommend to combat that? Or
well, they say breathing through your nose because it is heating the air. I mean, like, look, you're going to be losing. It's not so much the breathing in, it's breathing out. You're going to be losing heat anyway when you breathe out. It's just you can't combat that. The only people who aren't breathing are the guys who are already dead from hypothermia. So I mean, like, the best thing you can do is combat the amount of heat that you lose through your skin. And like like the old wives' tale is to a certain extent true. Wear the hat, wear the scarf, wear multiple layers. And if you are marching long distances, be really careful of sweat and sweat accumulation, particularly in socks. Dry socks are great. I mean, like. Buying the appropriate kind of gear. I mean, I'm not going to be a guy who's going to flog gear that's not necessary for people. But like, I'll give you an example. If you're going out and you haven't gone hiking or camping in months, make sure that you have the proper sleeping bag. If it's for 2 degrees Celsius to 20 degrees Celsius and it's currently -9, you're not going to have a good time sleeping that night. Like, I made that mistake. They're camping. It didn't bother me though. I was sleeping. I was like, "This is fine. It's t-shirt weather."
That was a good night's sleep. I slept from 9 o'clock at night or 9:30 at night until 8 in the morning. I've never slept like that except for outdoors.
I was only woken up by that big
the buck.
Yeah, the buck. He was huge.
Let's talk about that for a second, because I know people can get into a jam if they sleep with their mouth underneath their sleeping bag. It eventually fills up the loft of the bag with moisture. Yeah. But they do it because their face feels cold. Yeah. And if you look at different clothing from around the world, you'll see the wool ruff, not the wool, the fur ruff that's worn, like Siberian jackets, Eskimo jackets, and whatnot. In this country, I think it was a company called Dermatone. I might be off on it. But they used to sell it almost smelled like Vaseline that people would put on their cheeks.
It was like a petroleum.
Yes.
Okay.
What's the story with that? Does it actually work, putting like a petroleum-based substance on your cheeks?
Well, I mean, like, you're basically just smearing yourself in fat. But I mean, that's not a bad idea, I suppose. I mean, like, in the old days in Ireland, like way back when people didn't have central heating and all that kind of stuff, you'd have old guys who'd like cover themselves in goose fat.
Yeah, bear fat in this country.
Yeah, I mean, like, those guys, God bless them, wouldn't have a wash for most of the cold months of the year, and they kept themselves toasty. I'm not sure if there's a scientific paper on it, but seems to make sense. You're just adding an extra layer, you know, and it's not basically as you said yourself. I mean, like most the most important thing is that you actually get the appropriate gear.
Mm-hmm.
You know, I mean, you can cheap out on a lot of things. I mean, like we were talking about this with regards rifles. You know, I'd rather buy a cheap rifle and a really good scope. You know, it's like likewise with camping. Like, you know, there's certain things that you don't need to spend money on. All the things that where you're sleeping, keeping warm, that's essential.
Right. Good sleeping pad.
Yeah,
that type of thing.
and bring a jet boil. You know, things that you can generate heat on, you know?
Quickly, right? And that was the argument that we were saying. It's like, look, we could build a fire, and I did heat up my 1 cup of coffee I had over the fire, but it took a lot longer than you just pushing the button on a jet boil and getting. I think a jet boil is like, I think of it not only as camp kitchen gear, but like emergency medical gear.
Well, yeah, I mean, like I'll give you an example. Like, for example, we're talking about our best friend. Rectal rehydration.
Yeah, that's right.
I mean, like, you got to heat that water up somehow.
That's right. I love this stuff, by the way.
Yeah. So the cake or the not the rehydration.
The cake.
Okay. But I mean, like, I had this scenario with friends of mine in Southern Pines when we had that blackout.
Mm-hmm.
Like, automatically, like girl that I'm dating at the moment. Like, I mean, she didn't actually have electricity. Most of her stuff was run by electricity. She didn't have a stove overnight. She didn't have hot water. She didn't have a lot of things. So I mean, like, I had a propane generated heater and a jet boil. I mean, automatically you have warmed the room.
Mm-hmm.
I have a ton of thermal stuff anyway, and also, I mean, like, you have a means of making hot water for yourself to clean yourself, as well as an ability to cook. You know, so
on our camping trip, we talked about the blackout scenario and how it was an eye-opening experience for a lot of people, but it also caused a lot of people to get injured because they thought they were using common sense, which we know is not very common, and they would bring in their gas grills and try to heat the house with the gas grills.
Yeah.
I don't think we can continue talking about cold weather injuries if we don't bring up burns, but then also the how do you even recognize if you're getting carbon monoxide poisoning?
Oh God, well, it is a silent killer for a reason. I mean, like, look, you should have a carbon monoxide alarm. Get it checked. Like, you get drowsy. That's the problem. You get drowsy, you slip off into a deep sleep, and you don't wake up from it.
And no odor, right?
It's odorless. Yeah, I mean, you should get your carbon monoxide. I sound like I'm like doing this for a company now. Get your carbon monoxide alarm checked.
Mm-hmm.
That's all I can tell you. I mean, you slip into a deep sleep and you don't wake up from it. It's horrific. The other side of it is as well, I mean, like, fires and burns. I did see a lot of that. Burns, I mean, like, look, the way you address that is obviously depends on the extent.
Mm-hmm.
But by and large, in most packs that we sell here in Fieldcraft, we have basically aqueous solution dressings, like basically a cold kind of gel dressing, which you can wrap over. If you don't have that, saran wrap is that cling film here? Saran wrap?
Yes.
Yeah. So that can actually, the big problem for people who get severe burns, actually they lose a lot of moisture, a lot of hydration. You don't want to cover that with traditional gauze, because when it comes to someone like myself, you have a ton of tiny little fibers in there, and that's awful for infection. You get tons of terrible infection when you leave tiny little cloth fibers in a wound like that. Really, you want to do is just wrap it with cling film or saran wrap, prevent that moisture from leaving the body, and get them to a hospital as quickly as you can.
Yeah, one of our former associates, also a doctor, he said...
was it the shaving foam? And
yeah,
shaving foam and saran wrap. Was it saran wrap?
Yeah.
Yeah. I mean, it's common stuff's common. I mean, like...
Except for sense.
Yeah. I mean, like, but you can improvise an awful lot of things. Like, that's what we teach with our steer med class. Like, don't get me wrong, it's not all fun and rectal rehydration. Some of it is actual, just like how to improvise sutures, how to improvise this, how to improvise things for gunshot wounds, needle decompressions, and all that kind of stuff.
Right. Damn.
It's fun.
So, I'm trying to think. What were we talking about earlier when we said if you have been a cold related injury victim or patient, how a second cold related injury will impact you more. Like you're more prone to those if you had it once, right?
Yeah, it really depends on what you like. If you've gotten a degree of frostbite related tissue damage, like it's common sense to expect that that's going to be probably the joint or digit that gets affected a lot more frequently and a lot more aggressively the next time around.
Mm-hmm.
I mean, when you think about it, you do actually have ice crystals forming in your in your blood there. It's crazy to think about, but that'll cause massive damage to the tissue. I mean, like, I'm sure that the guys here in Fieldcraft will bring up images to supplement this podcast, but like if you've ever seen frostbite induced tissue damage in digits, it's pretty horrific. It's like almost like someone's being charred, really jet black. So I mean, like, if you have anything even close to that tissue damage wise, and you get another sort of episode of, I would say even frost nip or frostbite, it's going to affect you a lot worse.
Jeez.
Yeah.
I know that they say that with electrical burns, right? Or electricity. Like if your body produces some type of hormone, if you get electrocuted and then like it, I forgot all the details. I'm not the medical doctor.
You learn something new every day. I don't know.
Yeah. Now, obviously you're not a vet, but are there any things that we should be aware of for pets, like animals, like
in cold weather?
Yeah. Like, I mean, I remember camping with dogs and I was like, damn, that dog must be cold, but they find their own way. Like they're way more tolerant to the cold than we are,
Yeah, well, they don't sweat the same way we do either. They sweat out of their paws and they pant.
Mm-hmm.
I mean, like I've certainly seen here in North Carolina more overheated dogs than anything else. Like you know the usual story. Some owner leaves it in the backseat of their car with the windows rolled up.
Yep.
That's a terrible thing to do to an animal, right? But cold weather stuff, they're animals as well. They'll freeze to death too, They just happen to have a all year round coat. And dogs are smart enough. They'll try and dig themselves a little hole, bury themselves in it more or less, and keep themselves warm.
Mm-hmm.
Like, I'm not a vet. I can't tell you what are the warning signs that your dog's getting frostbite.
Yeah. But it's just worthy, like, knowing that it could happen, something like that.
Yeah.
All right, so we've been talking primarily about, like, these are the warning signs for you. These are some things that you should be aware of that could be happening to you. You're obviously a doctor. You have that relationship between you and a patient. If our listeners are listening and they wanted to test someone for, like, coherence.
Oh, yes.
How could they do that?
Yes, we teach this in nearly all of our medical classes. So in a hospital setting, we'd use something called the Glasgow Coma Scale, which is a really convoluted, very intricate and important test. But in a field setting, and I do this myself, and I have done it myself, we would go through an acronym called AVPU, which is alert, response to voice, response to pain, and then totally unresponsive. Okay, so and it's like with any scenario. And bear in mind, it's important to determine how the level of consciousness with people. There's so many different systems in the body that requires this knowledge. Like, for example, if you see someone unconscious or someone who seems to have his eyes closed on the ground, you're not going to immediately go into CPR. First thing you're going to do is say, "Hi, my name is Kevin," in a forceful, loud voice. "Are you okay? How are you doing?" And if eyes open, he said, "I'm just having a snooze." You're not going to just pound on his chest. So I mean, like, first off, is he alert? Like, we're both reasonably alert. Does he respond to voice? If your eyes were closed and you were slumped against the wall, I would announce who I was, my intentions, and ask if you're okay. If he wakes up immediately and says, "Yeah, I'm fine, don't worry about it," he's responsive to voice. If he isn't, however, you're going to have to elicit a pain response on this guy. Now, this has to be fairly gradual, because you're not going to run up to a random old guy and just give him a kick, So first off, you give him a shake. Basically make sure that he doesn't have a head and neck injury, so you're not damaging the C-spine, but you give him a reasonable shake, and then you move on. You graduated responses. So you go from there. You go for a nail bed response, where you basically get a pen or hard object, and you press against the top of the nail bed. It's exceptionally painful, but it's kind of covert and doesn't look like you're outright assaulting an elderly citizen. Okay, so you exert that pressure, and if he pulls his hand away from you, that does mean he's responsive to pain. It doesn't mean that he has to wake up. You just have to figure out if he's responsive to pain or not. And response is pulling away from a painful stimulus. In failing that, we go to a sternal rub. Now I do this on a lot of people who may have OD'd or something like that,
Yeah.
you know. And basically, it's just you get your knuckles and you rub it up and down against the sternum. And you don't do it softly. You're going to really hurt this part.
Mm-hmm.
But it's for their own benefit, so you got to be cruel to be kind. So that's what you do. That's a painful response, and if in failing that, basically he is unresponsive. Like at that point, you're saying to yourself, okay, we're going to have to go through our March protocol here. So you're looking at what's causing this, what's going to kill him quickest, and that's what we go through with March. Do you want me to explain that with what it is, or?
Yeah, why not? Real quick.
So March, massive hemorrhage, airway, respiration, circulation, hypothermia, head injury. You know, so.
Man, there's just so much to be said about the cold, what it does to the body, and the body responds in weird ways.
Yeah.
You know, what's the coldest you've ever been? Like,
over there
recently?
Yeah,
that was the coldest.
It was pretty cold towards the end of it. It was getting cold because we were very far east.
What was the temperature? Like that 35 to 45, or was it below freezing?
It was like it was in Celsius. It was like -9 Celsius. It was chilly, you know.
Coldest I've ever been, still to this day, was in Alaska, doing a float trip in the Arctic Circle.
Yeah.
This is in August, and floating down the Sag River, actually floating north on the Sag River towards Happy Valley landing zone. And I remember I had on full rain gear, full slickers. I'm sitting in the front of the raft and I'm getting sprayed. Now I've like a puffy jacket on, everything, but I could feel the cold through the jacket, and I'm jackhammering. And my buddy Mark Knapp, we had a jet boil, and as we're floating down the river, heating water, putting it in a canteen, putting that canteen in my body. Yeah. To this day, I have never been so cold in my entire life.
Yeah. But when you can't talk, that's, you're pretty damn cold.
It was bad when I was like, and I'm like, get to the side, and I'm like, I have to do something. Like I could not get warm.
That was, as I was saying to you, the other situations where I pulled off the sock and the guy had lost 3 toes. I mean, it was people, especially when it's damp, it's wet and it's cold like that, you're going to get an awful lot of injuries.
I've been running through like the mental checklist this whole time that we've been talking. We've been talking about the ways to fight off the cold, the ways that your body responds to cold, what you do when you're treating a patient. Here's one, because there are a lot of people out there that have families. Yeah. What about kids? Like they say that like kids are a little bit more resilient than the adults, right? Like I remember being a kid, I could fall out of a tree and I wouldn't break an arm. I wake up some mornings now and it's like I separate my shoulder. So what about with kids? Any special things you should worry about?
In some ways, kids are better patients than adults. I mean, like, and I know that most men our age will deny having any problems. Like,
that's not true.
Yeah. Like, I mean, like legs falling off, it's fine, leave me alone. But kids will actually complain. You want a complaining kid, because a quiet kid means there's something really wrong. Mm-hmm. It's kind of like, as I was saying, that the early stages of hypothermia. It's the same with everybody. Like, a kid will be shivering, he'll be cold, he'll announce that I'm shivering, I'm freezing.
Yeah.
When he stops shivering, that's when you're really worried, because that means he's not thermoregulating his body and he's going to get much, much worse.
And they generally run warmer than we do, right? Like
kids
or infants, right? Like
yeah, I mean, like I suppose you're talking about. Well, yeah, I mean, like also the fact is like most mothers are going to be unbelievably protective of their kid. They're going to be wrapping that kid up like a little Eskimo.
Yeah.
I mean, like there's not as much surface area to be losing, as much heat, So I mean, like, yeah, I mean, by and large, they're in better hands than our own,
Man, I mean, we could go on and on and on. But if you have one final message for the listener to just like, here's my warning, doctor's advice.
Yeah. What
is it about the cold?
Well, it's December, so go to Florida. It's warm there.
It's supposed to be warm here in North Carolina. It's pretty cold.
It is pretty. I think this is warm.
Like I'm still like finally getting that sensation back. Like it was cold this morning.
Yeah. It's warm. It's warm.
Maybe it was the magical fruitcake right there. That's my jam.
Yeah.
Well, guys, listen. There's a lot to be said about cold-related injuries. There's a lot to be said about the treatment for cold-related injuries. You can hear some of the different ways that your body can lose the cold from me, but if you're going to learn about what is actually happening to the body, no one better than listening to Doc. If you guys have any questions about the cold, about the courses that we run, whether it's the austere med, the winter survival class, anything like that, please reach out to us on Instagram. Please reach out to us, email, whatever you want to do, and we'll be happy to answer them. But take all of this advice to heart. And guys, hopefully you'll stay warmer than I did this morning. Doc, where can people find you? Do you want people to find you, or you kind no, not really? No. Guys, come to North Carolina to Fieldcraft.
Do the classes.
Yeah, come to the class. That's how you find Doc.
Yeah. Need a doctor's note for going to Florida.
Yeah.
Well, guys, thanks so much for tuning in. This is the Fieldcraft Survival Podcast, and we'll see you next time.
See you.